Hello and welcome. Today we're diving deep into the world of neurology to understand a fascinating, yet challenging, autoimmune disorder, myasthenia gravis. Myasthenia gravis, often abbreviated as MG, arises from a malfunction in the immune system. Instead of protecting the body, the immune system mistakenly attacks the communication pathways between nerves and muscles. While the exact trigger for this autoimmune response remains unclear, genetic predisposition and environmental factors are suspected to play a role. Some cases have also been linked to abnormalities in the thymus gland, an organ important in the immune system's development. The heart of myasthenia gravis lies in the neuromuscular junction, the critical point where nerve impulses trigger muscle contraction. In healthy individuals, acetylcholine, a neurotransmitter, is released from the nerve ending and binds to acetylcholine receptors on the muscle. This binding initiates muscle contraction. In MG, however, antibodies block, alter, or destroy these acetylcholine receptors. This prevents acetylcholine from effectively binding, disrupting the signal and preventing muscles from contracting effectively. Think of it like trying to start a car with a faulty ignition switch. The message is there, but the connection is broken. Myasthenia gravis affects people of all ages, genders, and ethnic backgrounds, although some groups may be more susceptible. While it can occur at any age, it typically presents in women younger than 40 and men older than 60. It's estimated to affect approximately 14 to 40 people per 100,000 worldwide, making it a relatively rare condition, but one that's important to understand. The hallmark of myasthenia gravis is muscle weakness that worsens with activity and improves with rest. This weakness often fluctuates throughout the day. Common symptoms include drooping eyelids known as ptosis, double vision or diplopia, difficulty swallowing or dysphagia, slurred speech, and weakness in the arms and legs. In severe cases, the respiratory muscles can be affected, leading to breathing difficulties and a myasthenic crisis, a life-threatening emergency. Diagnosing myasthenia gravis involves a combination of medical history, physical examination, and specific diagnostic tests. A neurological exam will assess muscle strength and reflexes. The edrophonium test, also known as the tensilon test, involves injecting a medication that temporarily blocks the breakdown of acetylcholine, improving muscle strength in MG patients. Blood tests can detect the presence of acetylcholine receptor antibodies or antibodies against muscle-specific kinase, known as MuSK. Electromyography, or EMG, can also be used to assess the electrical activity of muscles and confirm the diagnosis. While myasthenia gravis doesn't always neatly fit into strict classifications, it's often categorized based on the affected muscle groups. Ocular myasthenia gravis primarily affects the eye muscles, causing ptosis and diplopia. Generalized myasthenia gravis involves weakness in a wider range of muscles, including those in the face, limbs, and trunk. Seropositive MG indicates the presence of acetylcholine receptor antibodies, while seronegative MG occurs when these antibodies are not detected, even though clinical symptoms are present. MuSK-positive MG is a subset with antibodies against the MuSK protein, presenting with a distinct clinical profile. Currently, there is no cure for myasthenia gravis, but various treatments can effectively manage symptoms and improve quality of life. Medications, such as cholinesterase inhibitors, like pyridostigmine, help prevent the breakdown of acetylcholine, making more available at the neuromuscular junction. Immunosuppressant drugs, such as corticosteroids and azathioprine, suppress the immune system's attack on acetylcholine receptors. Thymectomy, the surgical removal of the thymus gland, can be beneficial for some patients, particularly those with thymoma, a tumor of the thymus gland. In cases of myasthenic crisis, intravenous immunoglobulin, or IVIG, and plasma exchange, or plasmapheresis, can provide rapid but temporary relief. Since the exact cause of myasthenia gravis remains unknown, there's no definitive way to prevent it. However, maintaining a healthy lifestyle, managing stress, and avoiding known triggers that can exacerbate symptoms, such as certain medications, can help minimize the impact of the disease. Early diagnosis and treatment are also crucial to prevent the progression of symptoms and improve long-term outcomes. The prognosis for individuals with myasthenia gravis varies depending on the severity of the disease and the effectiveness of treatment. With proper management, many patients can lead relatively normal lives. Ongoing research is focused on developing more targeted therapies that specifically address the underlying autoimmune mechanisms. Advances in understanding the role of B cells and other immune cells in MG pathogenesis are paving the way for novel treatment strategies, including monoclonal antibodies that selectively target these cells. These developments offer hope for improved long-term outcomes and potentially even a cure for myasthenia gravis in the future.